I'm going to discuss a few fun facts about possibly my favourite molecule, certainly my favourite of all the xanthine molecules anyway. That's right, caffeine. As someone who consumes possibly too much, and from my curiosity as a urology trainee, I've been compelled to learn a lot more about the molecule, and it has some really interesting properties. I've no formal disclosures to make, but I'll put it out there that I'm an AeroPress fan, which is under-recognised by society as a great way to make coffee, and often mistaken for a urological instrument. Going back to my career, caffeine keeps me in a job by its association, mainly with bladder function, but also with kidney stones and possibly male factor infertility. It all starts with the chemistry of the molecule, with a xanthine core and 3 methyl groups. It's an achiral molecule, meaning it's superimposable on a mirror image. Achiral literally translates to mean without hands, as hands classically demonstrate chirality. Excess caffeine can potentially cause a tremor, resulting in not being able to do certain tasks. You can literally become achiral from consuming it. Caffeine's metabolism is also interesting. I'm more of a kidney kind of guy, but caffeine is metabolized by the liver via the cytochrome P450 oxidase pathway. This removes the methyl group, thus forming a dimethyl xanthine, which includes paraxanthine, of which the majority is synthesized to, theobromine in 12%, and then finally, and possibly the most clinically interesting, is theophylline in 4%. Theophylline is a bronchodilator used to treat asthma. Theophylline haunts me as I spent a lot of time in my first year of qualifying as a doctor taking serum levels for this due to its narrow therapeutic range. Unfortunately, or fortunately, there is not sufficient levels of theophylline metabolized from caffeine to have significant therapeutic or toxic effects. I'm going to go on a slight tangent now with tea and theophylline, as the history is mildly interesting. First of all, the etymology of theophylline literally translates as god leaf. Secondly, it was first extracted from green tea leaves in the 1880s by Albrecht Kossel, the German biochemist. They should have called it teophylline. Its clinical use initially was as a diuretic. Here I'm mashing a Russian caravan tea blend which is reassuringly smoky, not too dissimilar from Lapsang Souchong. I hope you're enjoying the novel tea stirrer. Sadly, its novelty comes at the price of suboptimal utility. Going from tea leaves to coffee, there is something the beans in the bladder commonly share in their nomenclature. Coffee beans contain a compound called trigonylene, which should excite any urologist, as the area triangulated between the bladder neck and where the 2 ureters drain into the bladder is called the trigone. Trigonylene has antimicrobial properties against strep mutans, a common oral pathogen. So coffee may help with the fight against tooth decay and periodontal disease, although at the price of losing the fight against tooth staining. As a urology trainee, one of the bread and butter presenting complaints that I see in clinic is that of storage lower urinary tract symptoms. So this is where people tend to go to the loo more frequently, more urgently, need to get up at night, and sometimes leak urine as they can't get to the loo in time. This has significant effects on people's quality of life. One thing which can exacerbate this is caffeine, as well as other lifestyle factors. The mechanisms of how caffeine can affect bladder function are multifactorial. These include mechanisms in the kidney, the central nervous system, and also the bladder itself. I'm going to talk a bit about how the kidney is affected in this instance. Firstly, caffeine is a diuretic. Its mechanism isn't fully understood, but it is thought that adenosine blockade impairs sodium resorption in the proximal convoluted tubule of the kidney. As more sodium is excreted, natriuresis, water will follow by osmosis and get excreted, diuresis. This means the taps turn on quicker and the bladder fills up quicker. Filling the bladder quicker is only part of the story. Caffeine has been shown to increase nerve growth factor in the areas of the brain responsible for the micturition reflex that allows the bladder to empty, including the pontine micturition center, paraqueductal gray, and medial preoptic area. This enhancement of these areas is thought to facilitate some degree of bladder instability, where the pressures of the bladder are increased and it contracts inappropriately. In the bladder itself, there are a number of mechanisms as to why caffeine causes the bladder to become oversensitive. This includes the promotion of acetylcholine, which acts on the muscarinic receptors. An increase in cyclic AMP in the bladder muscle is also suggested to have an impact on bladder sensitivity. At a more superficial level, proteomic analysis of bladder epithelial cells have shown that 57 proteins are differently expressed when exposed to caffeine. What about kidney stones and caffeine? Caffeine and stones present an interesting paradox. I've talked about part of the metabolism of caffeine, but its eventual metabolites that are excreted are uric acid derivatives. In addition, caffeine consumption increases urinary calcium excretion. However, caffeine is associated with lower urinary oxalate levels and also a higher urinary volume, suggesting that the urine isn't supersaturated, one of the theories behind stone formation. Sadly, there is no evidence to say that coffee itself can be used as stone prophylaxis. However, this comes with a big warning that tea is very high in oxalate. Beware tea. Finally, on stones and caffeine, there is one very rare condition partly associated with caffeine that causes stone formation called xanthinuria, where xanthine oxidase deficiency stops the breakdown of xanthine down to uric acid. This is a very, very rare condition and accounts for fewer than 1% of all stones that are formed. I've always thought Nespresso should do podcasts. I'll finish off with a couple of things on male factor fertility and caffeine. There is a lot of inconsistency with respect to caffeine and fertility. It may negatively impact on fertility by damaging sperm DNA, but many parameters in larger studies show no significant effect on semen. The evidence, unfortunately, is still weak for now. Interestingly, caffeine can be added to semen when thawed for IVF, and it's shown to hyperactivate sperm through cyclic AMP and calcium. This increases their motility and also cellular metabolism. Whilst it's not overly relevant, I do find the idea of a hyperactivated caffeinated spermatozoon with all the moves almost worthy of putting on a mug. If you've made it this far, thank you and well done. You should celebrate by having a coffee. Unless you're the type of person that brews coffee at 100 degrees Celsius. If you do this, you have nothing to celebrate.